Hi there everybody, JP here, physiotherapist with We Fix You at our Port Hope location. It's official, we've been given the green light by the government and the Ministry of Health Long-Term Care to reopen our facilities to in-person treatments. Physical therapy, chiropractic, chiropody services, and massage therapy are all permitted to resume with the right precautions being taken. We're very excited to welcome back our staff and our patients, but we have to ensure the safety of our entire community as we gradually get things up and running. I wanted to put a little video together to let people know what to expect when they first return to the clinic. Things will look a little differently when you come back to our facilities, but we want to assure you that the standard of care will not be. We're all dying to get back to work and do what we love, which is helping people and helping educate them about where their mobility issues and pain are coming from. So We Fix You has had a dedicated COVID response team working on our reopening plan for the past 6 weeks. Some of our clinicians in physiotherapy have continued with telehealth, and we will be continuing to utilize that service as needed. But for people who are comfortable and who have been screened properly, we are resuming in-person treatments next Monday, June the 1st. We have created a triple screening process for patients looking to book an in-person appointment. And like I said, we're going to continue to utilize telehealth for people who don't feel comfortable coming into the community. Maybe they have immunocompromised systems who don't feel comfortable yet, and I want to ensure them that the telehealth is working very well for many of my patients. The first screening is going to occur when you book the appointment. We are going to ask you some questions about your health and your symptoms and your travel, just to ensure that you have been practicing social distancing and isolating as recommended by the government to date. The second screening will be done when you arrive at the clinic. We will ask that you call the clinic, or we can screen you at the door. Again, similar questions, but things can change. If you book an appointment a week in advance, we want to ensure that we're still screening appropriately. The third screening mechanism is a declaration form that we are going to ask you to sign, just so that we can track people and have a record that people understand the policies and that they're going to respect the rest of the patients and the staff on site as well. All staff will be wearing masks. I will be wearing gloves because I will be in contact with patients. But every day when staff arrive, we will be doing the same screening questionnaire that you will do at the time of your appointment. So again, we have a record of who is showing symptoms, and if that is the case, you will not be allowed into the clinic. When you arrive at your appointment, we will ask that you wait in your car and call the clinic if you have a cell phone. If you don't have a cell phone, we will have marked standing areas outside the clinic, and you can tap on the window, and we will be watching for you, obviously, because we are excited to see you probably just as much as you are to see us. We will not be utilizing the waiting room. We've taken the chairs out. We have 3 chairs that will be used for emergencies if people need to sit down, but we will not have people waiting in the clinic before their appointment is scheduled. I'm going to walk around now and just show you what we've done in the physio area specifically, because typically we see the highest volume of the other practitioners, but we're isolating and social distancing. We're not using all of our beds. So you'll see that you have one workstation, and then this one is closed, and then these will be used for storing extra equipment. And then you'll see we have the other one here. So physiotherapy will be offering in-person physio sessions, acupuncture sessions, and cold laser therapy. And we will be staggering starts so that I will only be working with one patient at a time, and you likely will not even see the other patients as they're coming in and out. When you come into the clinic, we will say, please go to bed number 1 and wait for JP there. So we just want you to know that we've taken all the precautions necessary. We've had, like I said, a team working on this for 6 weeks because when this all started, we thought we'd be closed for 2, but we feel ready, and we really appreciate all of our amazing patients' patience, their understanding in this weird couple months, and we really thank you for trusting us with your care. So go online, book an appointment, call the clinic, and we'll explain all of this stuff again, but the time has come. We're getting back to normal, and we can't wait to see you. So have a great rest of this week, a safe weekend, and we hope to see you as soon as possible. Thanks, and have a great day.